Well, we've got to learn some statistics. And especially, I'm paying attention to these things because of the fact that the exam is going to change very soon. And if it is MCQs, you've got to learn some hard facts. And if you remember, when we're reading about the causal conditions and the risk factors, they were really talking about some people from some ethnicity and all those things. So the highest incidence of drowning occurs among males, African Americans, children between the ages of 1 and 5 years, persons with low socioeconomic status, and in the urban regions. Let me say it again. Males, African Americans, children between the ages of 1 and 5 years, persons with low socioeconomic status, and urban regions. These are some of the risk factors which predispose the patient to drowning. Now, another thing you have to also learn is that the most common preceding activity for drowning is aquatic activity like swimming or boating. The most common preceding activity for drowning is aquatic activities like swimming or boating. The most common, because this one, we can set so many questions from this alone. The most common bodies of water involved in drowning are lakes, ponds, or flowing water. Okay? Now, what are the characteristics of victims who drown? Most of the time, they are alone. And 1/3 of those victims have a pre-existing condition like cardiovascular disease, physical disability, or seizure disorder. So please note these hard facts very well. Victims who drowned in bathtubs were more likely to have a seizure or neurocognitive disorder. So I'm not talking about children. I'm talking about adults who drown in. You get into a bathtub. It's not like somebody shot them or something. They were bathing and then they drowned in the bathtub. Usually, the reason why what is the most common cause of adults who drown in bathtubs? The answer is seizure or neurocognitive disorder. Doctors, are we all on the same page? Okay, good. So let's go through some questions. A 16-year-old boy is found unconscious near a river after a day of heavy drinking with friends. He has a serum ethanol concentration of 180 milligram per deciliter. What factor most likely contributed to his increased risk of drowning? 16-year-old boy, unconscious, near a water body. What most likely contributed to that? A, inadequate adult supervision. B, inability to swim. C, use of alcohol. D, hypothermia. I think this is a very simple question. The answer is alcohol, because the question even said that after a day of heavy drinking, right? So alcohol consumption significantly increases the risk of drowning. A serum alcohol level more than 150 milligram per deciliter is associated with a 37-fold increased risk of fatal drowning. So that is simple. That's a very simple question. Okay, let's continue. A 14-year-old Black American girl is brought to the emergency department after nearly drowning in a swimming pool. What demographic factor likely contributed to her higher risk of drowning compared to white children of the same age? A, risk-taking behavior. B, hypothermia. C, race and ethnicity. D, seizure disorder. Let's go, let's go, let's go. Let's go. What's your answer? C. Sure. We said that Black Americans and Blacks have an increased risk of drowning as compared to Caucasians. Okay, let's go. Next question. A 10-year-old boy with a history of developmental disorder is found unconscious in a bathtub. Which factor may have contributed to his increased risk of drowning? A 10-year-old boy with a history of developmental disorder is found unconscious in a bathtub. Which factor may have contributed to his increased risk of drowning? A, concomitant trauma. B, undetected primary cardiac arrhythmia. C, developmental or behavioral disorder. D, hyperventilation prior to a shallow dive. And the answer is C. Okay. Developmental or behavioral disorder. Children with developmental or behavioral disorders are at risk of drowning. This highlights the importance of supervision, and because the question says that the child has a developmental disorder. Okay, good. Now, 20-year-old woman is brought to the emergency department after a near drowning incident in a lake. She reports hyperventilating before diving into the water. What physiological consequence of hyperventilation likely contributed to her increased risk of drowning? 20-year-old woman is brought to the emergency department after a near drowning incident in a lake. She reports hyperventilating before diving into the water. What physiological consequence of hyperventilation likely contributed to a risk of increased risk of drowning? A, respiratory alkalosis. B, cerebral hypoxia. C, cardiac arrhythmias. D, loss of consciousness. So the answer is B, cerebral hypoxia. Dr. Maduka, you went for A. Dr. Jibola, you went for A. No, the answer is cerebral hypoxia. Hyperventilation, now this is the reason. Before a shallow dive can lead to cerebral hypoxia, seizures, and loss of consciousness, increasing the risk of drowning. So the complications of hyperventilation and those in the main course, I'm going to for your revision towards the May exam, I'm going to do a deep dive into drowning beyond this class, and we're going to look at the pathophysiology of why, so that you'll be able to be properly informed when you are dealing with some of these cases, because of course, like, this webinar will not be able to address all the issues about drowning. So the issue of hyperventilation before diving is very important, and hyperventilation before diving can lead to cerebral hypoxia. And if you have a patient with cerebral hypoxia, they can have seizures and they can have loss of consciousness. So when you see hyperventilation in a patient who wants to dive into a water body, things which should start getting into your mind are cerebral hypoxia, seizures, loss of consciousness.
I have a question, doctor.
Please ask the question. Please,
so
please,
in this question, Fijiro,
sure.
Dr. Fijiro, in this question, you said cerebral hypoxia and loss of consciousness can be the answer. In the options, those two are present. So what made you choose cerebral hypoxia instead of loss of consciousness?
So cerebral hypoxia occurs first.
Okay.
Yeah. Cerebral hypoxia occurs first. Then loss of consciousness is as a result of that. Maybe in reality, I should not have put that there, because the loss of consciousness, because it becomes confusing. But in order of which one leads to what, cerebral hypoxia will lead to loss of consciousness. Okay. But it's a very good question you asked. So risk factors for drowning, we've already talked about it. Inadequate adult supervision, inability to swim or by estimation of the patient's swimming capacity, risk-taking behavior, use of alcohol, Black American and Native American, including Alaskan natives. So these are some of the risk factors for drowning, okay? And other risk factors could be hypothermia. So if the weather is very cold, it can lead to rapid exhaustion and cardiac arrhythmias. So hypothermia can lead to rapid exhaustion and cardiac arrhythmias. Concomitant trauma. So assuming the person is in a water body and then hits the head against some rock in the water body. Boom. The person can also have a stroke or a myocardial infarction. That's why we said that a lot of people who also drown, they can have an underlying cardiac condition as well. Okay. And then they may also have a seizure disorder. And they may have developmental and behavioral disorders, which we've already talked about. And they may have undetected primary cardiac arrhythmia. Okay. And then they can hyperventilate prior to a shallow dive. And I think I put this to explain it. So in order to prolong underwater duration, because some people want to go very deep, so they take deep before they go. Okay. I am not a swimmer, so I'm already struggling. So swimmers commonly hyperventilate prior to submerging to reduce the arterial partial pressure of carbon dioxide. As the individual swims, Oxygen is consumed. Thus, the partial pressure of oxygen can drop to 30 to 40. These are all highfalutin stuff. This can lead to cerebral hypoxia, basically seizures and loss of consciousness. So those are the three things I want you to remember. Hyperventilation, drowning. Why? Cerebral hypoxia, seizures, loss of consciousness. Cerebral hypoxia, seizures, and loss of consciousness. All right? Okay, good.